Debate over a second wave of the COVID-19 virus is now underway. At odds, politicians versus public health and medical providers. Some say it's not a matter of if, it's a question of how. Medical reporter Liz Bonus explains.
Already we are hearing that in some parts of the United States, emergency rooms and intensive care units are nearing capacity once again from new cases of the coronavirus.
Well, there have been some increasing prevalence of disease, particularly in some southern states, Arizona, Texas, especially some of the border states.
The problem is, according to infection control specialists who follow virus trends, a second wave is unavoidable. It's just a case of whether we get it as a slow drip or a huge surge. Here's what the nation's top doctor told our Sinclair partner, Stadium.
You can avoid a second wave if you have the capability, the manpower, the infrastructure, the tests to do the identification, isolation, and contact tracing, so that when those blips come up, you'll be able to prevent them by containing them from becoming an outbreak. So you talk about a second wave as a big explosive outbreak. It isn't inevitable that that will happen if when you get the inevitable little blips of infection, that you actually suppress them. So we're hoping we don't get a second wave. We have to be prepared for a second wave. And we can blunt it if we respond to it in a proper manner.
We also may get help from emerging vaccines, which according to the COVID-19 Therapeutic Development Tracker,
3 of those projects have announced that they're coming close to entering phase 3 trials. One as early as the end of this summer and into the fall.
Since the virus is expected to reemerge more dominantly when we hit fall flu season, this too might help us better ride the second wave. I'm medical reporter Liz Bonus reporting.